A very good afternoon. I'm Dr. Jayanti Bangadasalam, the Medical Director of Hospital Fatima. This year, we at Hospital Fatima join forces once again with WHO to celebrate the World Patient Safety Day by dedicating a week of activities and programs in line with the theme Safe Maternal and Newborn Care. Approximately 810 women die every day from preventable causes related to pregnancy and childbirth. In addition, around 6,700 newborns die every day, amounting to 47% of all under 5 deaths. Fortunately, the majority of stillbirths and maternal and newborn deaths are avoidable through the provision of safe and quality care by skilled health professionals working in a supportive environment. Hence, this year, Hospital Fatima will be dedicating this week from 13 September to 17 September, focusing on the above theme. We have a lineup of online activities and talks which will be streamed on our Facebook Live. Please do follow our Instagram, Facebook and websites for more information. Thank you and stay safe always. A very good afternoon. I'm Dr. Jayanti Bangadasalam, the Medical Director of Hospital Fatima. This year, we at Hospital Fatima join forces once again with WHO to celebrate the World Patient Safety Day by dedicating a week of activities and programs in line with the theme Safe Maternal and Newborn Care. Approximately 810 women die every day from preventable causes related to pregnancy and childbirth. In addition, around 6,700 newborns die every day, amounting to 47% of all under 5 deaths. Fortunately, the majority of stillbirths and maternal and newborn deaths are avoidable through the provision of safe and quality care by skilled health professionals working in a supportive environment. Hence, this year, Hospital Fatima will be dedicating this week from 13 September to 17 September, focusing on the above theme. We have a lineup of online activities and talks which will be streamed on our Facebook Live. Please do follow our Instagram, Facebook and websites for more information. Thank you and stay safe always.
Good afternoon, ladies and gentlemen. Welcome once again. I am Akma from the Sales, Marketing and Public Relations Department, Hospital Fatima Ipoh, and I'm pleased to introduce to you our speaker and topic in this third talk in our series of talks in this Patient Safety Week. Today, we have with us our physiotherapist, Ms. Kumisha Aravind Dinest, who will share her knowledge with you with a talk entitled Safe Physical Exercise During Pregnancy and what more. She will demonstrate suitable live exercise on video presentation. I am sure you are eager to hear the talk now, which is about 45 minutes, and we will have another 50 minutes in our Q&A session immediately after the talk. So without further ado, it is my pleasure to introduce to you Ms. Kumisha.
Hi, good afternoon, everyone. Thanks for joining me today for a very brief session on my talk today in conjunction of Patient Safety Week 2021. It's a great pleasure to be here as a speaker and to share on some useful info for expecting mothers, especially at this kind of pandemic. Welcome to all followers and congratulations to all pregnant mothers. We all know that the health and well-being of expectant mothers and their babies are of utmost importance, and you will be looking forward in getting the best for you and your baby. So I hope you will gain some info from my topic today, which is on safe physical exercise during pregnancy. Okay, I will be covering on all trimesters in general. Okay, so basically it's going to be on what is exercise. All right, so you can see on the screen, what is exercise, how safe is exercising during pregnancy, how much of exercise is needed, why is exercise important and the benefits of exercise, when is it not safe to exercise, example for things and symptoms to look out for during pregnancy, and to share on some videos and simple demo and general exercises. Okay, here is a slide showing exercise during pregnancy. Okay, so I'm going to cover on safety, pregnancy exercises, do's and don'ts, and also benefits. Okay, first of all, what is exercise? Exercise in simpler words means in activities that are done that uses energy and current physical conditions such as walking, mopping, sweeping, hanging clothes, and your daily chores. Okay? Physical activity means a regime that has been structured and planned or has repetitions. Example, I will show you in my slides later. Okay, what are the importance of exercise? Okay, first of all, exercise increases your energy level. Example, during pregnancy, it is normal for you to feel tired and weak. So when you do exercises, it helps to increase your energy level. As our tummy grows, the pressure on the spine increases, thus it makes it more painful. So exercise helps to relieve backache. Next will be improve your posture by strengthening exercises. Doing strengthening exercises and stretching exercises help to relieve your pain and improve your posture. Prevent wear and tear of joints by doing strengthening exercises. Promotes good sleep. Okay, next will be increased blood flow. Example, pregnant mothers would usually have swelling on the legs and ankles during mid-trimester and also towards the end trimester. So exercises actually helps to reduce blood flow by doing all circulation exercises. Next would be to prepare a woman's body for birth. Okay, I will demonstrate all these exercises later. Next would be to maintain the body weight, improve cardiovascular function, reduce risk of gestational diabetes, to ease discomfort. During the first trimester, you will be having nausea, vomiting. So exercise, mild basic exercises will help to relieve all these symptoms and also to improve mental health. Mental health in ways of reducing stress and anxiety during pregnancy. As we know, a happy pregnancy, a happy baby. Okay, next we would move on to the contraindications. Okay, during pregnancy, it's best to avoid exercises such as excessive bouncing, jumping, or high impact activity. Unless you were previously trained and at high level before pregnancy, heavy impact aerobic activity is not recommended. Okay, in our body, during pregnancy, the hormone called relaxin can cause ligament and joints to become increasingly loose. Although with certain exercise, you may feel flexible, it's best to avoid overstretching as it can lead to injury. The center of gravity also changes as the belly gets bigger. Remember to always perform safe movement and exercises. Is it safe to exercise? Yes. Always make sure to do exercises that are within your energy limits. Some of the symptoms that you need to see before you start an exercise or when you are doing an exercises, look out for these symptoms. Example, shortness of breath, dizziness, vaginal bleeding, uterine contractions, chest pain, calf pain, abdomen pain, leakage of fluid, decreased fetal movement, congestive heart failure, pregnancy-induced hypertension, or previous miscarriages and multiple pregnancy. It is best to seek advice from your doctor before you start any exercises. Always check with your gynae or any physical therapist. As your pregnancy increases, modify your activities to ease up workouts to try to do something not strenuous to your body. Okay, how much of exercise is needed? We all know that exercise is important, but how much of exercise is needed? Do we do exercises every day? Okay, so here I'm going to explain about the frequency, intensity, the time, and the type of exercise. Okay, I'm going to explain to you about aerobic activity. Aerobic activity means exercises or activity that involves faster breathing or deep breathing. Okay, so example, something that makes you to breathe fast and heavy, increase heartbeat, and something that makes you sweat out. For example, it could be walking, jogging at the initial stages of pregnancy, house chores, static cycling, and it could be any exercises, example, stepper. Alright, so for frequency, it is always advisable to do 3 to 5 times per week. These are all basic frequency that I would advise you to do for every pregnant mothers in all trimesters. If you were to increase the frequency, please consult your gynae or a physical therapist. The intensity will be moderate intensity. All right. Time would be around 30 minutes per day. Okay, these 30 minutes, you don't have to do it one go. You can split this into 10 minutes 3 times per day. Take time to rest in between. Do not exert yourself or do not push yourself beyond your limit. Take your time and enjoy the exercises. Type of exercises would be low medium intensity aerobic exercise. Okay, during the 1st to 3rd month in pregnancy, if you were active in several months prior to the pregnancy, you should remain active but follow the FIT guidelines that I explained to you earlier. If you were inactive before your pregnancy, an example, you don't do any exercises before pregnancy, try to hold on doing exercising for the first 3 months till you feel much better and confident in doing your exercises, providing that you have gotten the agreement from your gynae or your physical therapist. Always consult your health provider. Nausea and fatigue may limit your endurance, so shorten your routine. Reduce the frequency or change the time of day you exercises. During this period, it is still safe to lie on your back. Take this opportunity to strengthen your abdominal musculature, as this will weaken very quickly once your abdomen starts to expand. Women with strong abdominal muscles will return to their pre-pregnant figures faster after giving birth and will suffer less back pain. Okay, during the 4th to 9 month in pregnancy, active women are able to increase their exercise intensity during the 2nd trimester by 10 to 15%, but within the target zone established by your healthcare professional. So you can gradually increase your exercises that you have been doing following by your healthcare professional, advice from your healthcare professional. Inactive women may begin low-impact aerobic activities such as walking, swimming, or cycling. Always remember the 3 S, slow, steady, and safe. Let me remind you that not all pregnant mothers are the same. Everybody are special in their own ways, so take time to know your body. All right, next, we'll be moving on to our exercise. Okay, now we'll be moving on to our next slide on list of exercises that I have compiled for you that I will be explaining while you watch the videos. You are most welcome to follow the exercises as we go through each one of it. This live talk will be saved in our Facebook page, so those who are unable to follow, you may do it later as well. Okay, so we are going to cover the upper body, which will be including deep breathing exercise, bicep curls, dumbbell side raise, shoulder circles, sitting hip stretch, abdominal side stretching, resistance exercise, gym ball exercise, and pelvic bridging. Okay, Agma, can I have the slide, please? Full screen of the slide. As you can see, the mother is breathing in on the tummy. Okay, so she's taking a deep breath. She's not moving her chest, but only the stomach. You can see the movement on the stomach. Deep breathing exercise is very important, especially during labor. It helps to ease pain during labor and helps you to control your breathing better for a safer and ease your delivery. All right, next, we move on to bicep curls. Okay, so you get your dumbbells, stand straight, okay, with a straightened posture, palm facing forward. Without moving your arm, bend your elbows and curl the dumbbell towards your shoulder. Hold for 5 seconds and slowly return to your starting position with arms fully extended, straight down. You may repeat this exercise 10 times with 2 repetitions. Okay, next we'll be moving on to dumbbell side raise. Okay, the same thing. We grab a dumbbell. Make sure your posture is always stay straight. Stand up straight. You can even do this in sitting. Palm facing down. Okay, lift 2 hands up until the arm is parallel to the floor. Hold for 5 seconds and lower down to the start position. This will help to strengthen your upper back and also your shoulders. Okay, our next exercise will be shoulder circles. For this exercise, I will be demonstrating to you this exercise. Agma, can I have my full screen, please? All right, so this is how we do it. All right, so you either can sit or you can stand. So I'll be standing so I can show you clearly what's happening. Okay, what you do is hands at the side. Okay, you can even use a dumbbell. Okay, in my case, I'm using a dumbbell. Okay, rotate your shoulder backwards in bigger circles. Okay, open your chest when you are doing this exercise. This helps to strengthen the shoulder and your upper back muscles. Okay, continue the same exercise, and this helps to prevent rounded shoulders during pregnancy. It's very common for mothers to have rounded shoulders during pregnancy due to the weight of the stomach. So this exercise helps to reduce the rounded shoulder during pregnancy. All right, next will be sitting hip stretch. This exercise, I will be demonstrating to you. I hope you can see. Okay. Janice, the screen please, thank you. All right, okay. So sitting hip stretch. All right, so you're going to sit on a chair. In my case, I'm sitting on a gym ball. Okay, so what you can do is for pregnant mothers, you can open up your legs slightly. All right, and then put your legs upwards and slowly push your knee downwards. All right, it'll be much balanced if you do it on a chair. All right, so push your knee downwards. You can feel a pulling on your ITB band. Okay, all right. Slowly bring your body forward without bending the spine. Do not bend your spine. Make sure that your spine is straight. You can feel the stretch. If you still can't feel the stretch, push your knees down further. Okay? Repeat this for 10 times. Relax and push down again. And relax and push down again. Repeat this for both legs, right and left. Okay. All right. Next, Akma, can I have the full screen, please? Thank you. All right. Next will be abdominal side stretching. Okay. For this exercise, you need to sit on a mat or a bed. Okay. If you have a yoga mat, you can sit on a yoga mat. Fold your legs. Lift up your hands towards the side of your body. Hold for 10 seconds and relax. You repeat again on the opposite side. Lift up your hands towards the other side of your body. Hold for 10 seconds and relax to start position. Similar, repeat this on the opposite side for 10 times for each side. Okay, next will be resistance exercise using a TheraBand. This exercise is involving a TheraBand. If you have a TheraBand, you can actually do this exercise at home. Okay, so this exercise is very simple. You use a TheraBand to stretch to the side. This helps to strengthen your upper body. And you can even put your hands above and stretch. Repeat this for 10 times. Hold for 10 seconds. Okay, next would be back stretch using gym ball. Okay, so you can see she's seated on the bed. She's not lifting up her legs. She's bending her body forward with the gym ball placed in front of her. She's actually stretching her backs to relieve tight muscles on the upper back and the spine. You repeat again. Go forward, stretch, hold for 10 seconds, and relax. All right, next we'll be moving on to pelvic bridging. Start by lying on your back using a mat, or you can even lie on your bed. Bend your knees with the feet flat on the ground. Lift your buttocks up while squeezing your buttocks. Okay? Use your feet to push down on the bed as a support. Slowly lift up your buttocks. Hold for 10 seconds. And lower slowly to start position. This pelvic bridging is part of Kegel exercises, which I'll be explaining to you later. It helps to strengthen the glutes muscle, which is the buttock muscle. This helps to ease labor, makes it easier during labor and pushing, helps to support the lower back and reduce the pressure at your lower back. Okay, next I'll be moving on to mid lower part of the body. Okay, I will be covering cat-camel pose exercise, pelvic rotation on gym ball, back strengthening exercise, standing hip extension, wall squat using gym ball, calf stretch, and pelvic floor exercise. Okay, here is a short video on the cat and camel stretch.
To do this exercise, you will need a non-slip mat. Get into the all-fours position on your hands and knees. Make sure that your knees are hip-width apart and your arms
Spine is straight. Look up and arch your back.
under your shoulders. Your spine should be in a straight line. Now, slowly arch your back and look up at the ceiling. Hold this position for 4 counts. This is called the cat stretch. Next, round out your upper back and look down at your neighbor. Hold this position for 4 counts. This is called the camel stretch. Let's show you how to do this once again. An arch and a round. You can repeat this exercise up to 4.
Okay, so as you can see earlier, she was all on her knees with the abdominals draw in, spine straight, looking upwards with arching your back, which is called the cat exercise. Okay, it is advisable for pregnant mothers in the last trimester to not do this exercise. All right. Okay, then exhale and round your back as you tuck your chin downwards towards your chest. Okay, this will be the camel pose. Okay, this exercise helps to reduce the curvature of your back, reduce the nagging and consistent back pain that you are actually having during pregnancy, strengthen your upper and lower back, and help relieve back pain. Okay, next we'll be moving on to back muscle strengthening exercise.
To begin, get into the all-fours position on your hands and knees. And your legs are hip-width apart. Now, extend your left leg straight and behind you. Hold. Now, keeping your left leg in this position, lift your right arm up to shoulder height. Maintain this balance for about 10 seconds. Place your hand and knee back on the floor and relax for a moment. Let's show you this exercise once again.
Okay, so as you can see, the same thing, back muscle strengthening exercise. Okay, so she's on her knees, okay, on her hands and on her knees with her spine straight, the legs with hip width apart. Okay, she's lifting up her left leg behind with her right arm at shoulder height, okay, and she's holding it for 5 seconds. We will watch the video again.
To begin, get into the all-fours position on your hands and knees. Make sure that your spine is neutral and your legs are hip-width apart. Now, extend your left leg straight and behind you. Hold. Now, keeping your left leg in this position, lift your right arm up to shoulder height. Maintain this balance for about 10 seconds. Place your hand and knee back on the floor and relax for a moment. Let's show you this exercise once again.
Okay, so next, we'll be moving on to the next exercise. Will be wall squat using gym ball. Okay, for this exercise, you will be needing a mat and also a gym ball.
For this exercise, you will need a non-slip yoga mat. Stand on the mat with your feet hip-width apart. Next, take an exercise ball and place it in the small of your back, just above your hip and touching the wall. Now, let's do a squat. Slowly go down till your thighs are parallel to the ground. For this exercise, you will need...
Alright, sorry. I'm just going to explain on the exercise. Okay, for this exercise, you need to be using a mat. The mat is to support your legs so that you don't slip while doing the exercise. Place the exercise ball behind your back. Okay. Squat slowly and keep your knees 90 degrees. Alright. Hold for 5 seconds. As you bend down, as you squat, the exercise ball will roll down the spine as we bend. Repeat this 10 times. We shall watch the exercise again.
For this exercise, you will need a non-slip yoga mat. Stand on the mat with your feet hip-width apart. Next, take an exercise ball and place it in the small of your back, just above your hip and touching the wall. Now, let's do a squat. Slowly go down till your thighs are parallel to the ground and your toes will remain in line with your ankles. As you go down, the ball will roll up your spine. Come back to standing position. Let's take a look how to do this once again.
Alright, so you have to repeat this exercise for 10 times. The purpose of this exercise is to improve elasticity of your pelvis, to make your labor easier, and to correct your posture. Alright, next will be on pelvic rotation on the gym ball. Alright, so I'll be demonstrating this to you once again. Okay, so you're sitting on a gym ball. Alright, if you have a gym ball, you can actually do this exercise. Okay, with your hands on your hips. Alright, and you go around. So this is called a pelvic rotation. Make sure you don't move your whole body. You're only moving your pelvic. Alright, so you're moving to the side, circular, and back to start. I repeat once again, pelvic rotation. One circle, one round, and back again. You can repeat this 10 times, and you can even do this on the opposite direction, clockwise and anti-clockwise. Okay. Alright, next will be standing hip extension. I'll be showing you this exercise as well. It's very simple. You'll be needing a chair. Okay, so the chair is right in front of you. Make sure it's a chair that is sturdy. You wouldn't want the chair to move in front or for you to fall. Hold the chair, look forward, spine straight. Slowly extend your leg backwards as much as you can. If you can't go further, it's okay. Lift up, extend, hold for 5 to 10 seconds, and slowly down. You repeat on the opposite side. Extend your legs to the back, hold for 5 to 10 seconds, and relax. Once again, extend your legs to the back, hold for 5 to 10 seconds, and relax. Okay, you can repeat these exercises 10 times as well. This helps to strengthen your lower limb muscles. Okay, Agma, full screen please. Okay, next would be the ankle and calf stretch. Alright, this is a very simple exercise and a very important exercise as well. You can be sitting on a bed or a mat. Lean on the wall or place your hands beside somewhere where you can support. Bring your feet forward and backward. Okay, I'll replay it again. Bring your feet forward and backward. Hold for 5 seconds. Repeat 10 times. You can also actually use a towel or if you have a TheraBand to actually place it on your feet to stretch. It will be much easier. But if you don't have, this exercise is good enough. This calf stretch helps to loosen up tight muscles on your lower limbs, especially those who actually sit for long hours or prolonged standing. It helps to decrease swelling on the lower limbs. After a hard day at work, you can actually do these exercises to relieve your swelling on your lower limbs. Alright, next we move on to pelvic floor exercise. Pelvic floor exercise is also known as the Kegel exercise. It helps to strengthen the pelvic floor muscles. It helps the body to cope with the growing weight of the baby, and it prevents incontinence during and after pregnancy. Kegel's exercise. Okay, why do we do a Kegel's exercise? It's to strengthen the muscle of the pelvic floor, help to build strong muscles around the vagina, which will help during your childbirth, to prevent prolapse of pelvic organ. Hold 5 seconds and repeat 5 times per session, 3 sessions a day. Okay, so how are we going to do this? Okay, how to perform a Kegel's exercise? Firstly, you tighten and lift your anus and vagina. Okay, so you just imagine this is your anus. So you're going to tighten it and you're going to relax it. Imagine you're stopping the flow of urine. Okay, so you're holding on to your urine. So you tighten and you relax. Okay, when you do this exercise, hold for 10 seconds, 15 times. You can try doing this exercise 3 times a day. For those of pregnant mothers who are having incontinence or frequent urination, you can perform this exercise 3 times per day. You can even consult your doctor. Okay, when can you see a difference in when you do a Kegels exercise? Okay, for some, you can see it within weeks. For some pregnant mothers, it takes months for you to see a difference. All right. This exercise can actually be difficult, which requires a lot of practice. Okay, these are one question that is always asked by pregnant mothers, whether can I do squatting? Is squatting safe? Is squatting dangerous for my baby? Okay, so as we know, squats are one of the most popular and effective exercise, okay, for building our lower body strength. Pregnant women may choose to incorporate squats into their weekly routine, all right? Squats can even offer many benefits for both you and your baby during pregnancy, labor, and after delivery. All right. This is why squatting during labor and delivery may help open your pelvis and make the baby descend. This is why squats can also be done as exercise to practice. All right, so you can see the picture. I have attached a picture of squatting. I'm only going to show you one example of squatting, which is safe for all trimesters, which is called the sumo squat. Okay. The first picture is a sumo squat. The second picture is a forward squat. This can be done during the early trimesters, okay? Because the tummy is still small, the belly doesn't get in the way, and it's easier for you to do this squat. As you advance throughout your pregnancy, you can do the sumo squat as an alternative when the front squats aren't helping. The belly gets in the way, it becomes more difficult, and there's more room for your belly, and it reduces pressure on the knees. Okay, so how do you do this sumo squat? So you stand with feet 2 shoulder width apart with your toes facing out. Bend deeply using your knees, chest, and shoulder upright. And try to cover as much as back to starting, and then you go back to starting position. I will demonstrate to you this exercise. All right. So you're going to be standing like this, all right? You can even place your hand forward or grip your hands. If you feel not confident, you can have a chair in front of you to support. So you're going to be standing like this and slowly downwards. Try not to go too low. Go according to your pace. If you can go lower, that will be better. But try not to strain yourself. And slightly up. And squat again. Hold for 1, 2, 3, 4, 5, and slowly up. And down again. 1, 2, 3, 4, 5, and slowly up. Okay, as you practice this exercise, you can slowly, gradually increase from 5 seconds to 10 seconds. So yes, squatting is actually good for you. All right, next I'll be covering on bad pregnancy versus good posture. Okay, posture is very important during pregnancy as well. Okay, and I'm going to show you on the correct lifting position. Okay, so firstly, when you want to lift up something from the ground, keep your back straight, bend at your knees and hips. To pick up an object that is lower than the level of waist, always use your knees. Do not bend with your shoulder downwards. Okay, this is the incorrect lifting position. Do not bend forward at the waist with the knees straight. As you can see in the picture, this is actually straining her back even more, which will cause even more excessive back pain. Okay, so this diagram shows a proper standing and sitting posture. So this is how you need to stand and sit during the do's and don'ts. Okay, here I've attached back support for pregnant mothers. Those who are having excessive back pains and you feel that you need to use this, especially if you are standing, working long hours, you can actually use this lumbar belt to help to ease pain, okay? From your sacral iliac joint, you can actually get this from the nearest pharmacy, or you can even consult your doctor before you use this. This helps to relieve the pressure on the frontal, on your tummy area. Okay, next I'll be covering on tips for exercises. Okay, these are very important. Always pay attention to your body. You know your body best. Do not overexert yourself or exercise to exhaustion. Be cautious when you are lying on your back, especially during the first trimesters and towards the second trimesters. Drink plenty of water to avoid overheating and dehydration. Do not exercise in hot weather. Wear cool, loose-fitting clothing. Do not hold your breath during any exercise. And one more thing important is do not do exercises in empty stomach. Have a fruit or something light before you start exercise. All right, with that, I thank you all and hope you gain some info that you will actually try to practice in your daily regime.
Thank you, Ms. Kumisha. Okay, we will have our Q&A session now. Okay, let's start with our first questions from the audience. Okay, we have one question from, I guess this is from our medical director, Dr. Jayanti Vengadarasalam. When is it safe to start exercising in a pregnant person?
Okay, when is it safe to start exercising for a pregnant person? Okay, as I mentioned earlier, it is always basic exercises are safe to be done, but always seek from your medical doctor or any physical therapist to make sure that these exercises that you are doing are safe for you. As I mentioned earlier, each and every exercises are different and varies according to individual. Always check with your medical personnel before you start an exercises. Exercises can be start as early as your first trimester, depending on your symptoms and how do you feel during the pregnancy.
I see. Okay. So we go to the next question, Ms. Kumisha. It is from Ms. Sharina Abdul Manaf. Can pregnant mom do outdoor activities such as jogging or cycling?
Okay, all right. Okay, hi Sharina. Okay, regarding this, can pregnant mother do outdoor activities? Okay, during the first trimester, you can actually do very mild, brisk jogging or brisk walking. It is actually quite safe to do. Consult your doctor to make sure that providing that you don't have any other side effects or any other contraindications or any complications in your pregnancy. If everything is safe and you get a green light from your doctor or your physical therapist, yes, you can go ahead with jogging. As for cycling, it is always recommended to do exercises with both feet on the ground, not with both feet above. So cycling would be better if you do static cycling, all right? So in one space. So you get an indoor cycle, that will be much better and recommended. It is also quite safe if you don't use a bicycle in case you have a fall. So it's always better to do static cycling.
I see. Okay. Let us see, is there any more question? Yeah, there's another one more question, Kumisha. It's from Miss Raja Lachumi Kandasamy. Hi Kumisha, good afternoon. Number one, when will be the best time for exercise for pregnant women? And what lumbar support belt can use after delivery or not?
All right, okay. First question, when will be the best time for exercise for pregnant women? Okay, best time would be, as I said, towards your beginning of pregnancy. First trimester is fine. Maybe you can do some simple breathing exercises involving sitting on the bed instead of standing and squatting. Okay, and you can even do these exercises towards second trimester, third trimester, like all the exercises explained earlier, it's very general. It can be done at all times in every trimesters. Okay. As for the lumbar support belt, can be used after delivery or not? All right. So usually after delivery, it depends. If you have a cesarean delivery, it is usually not recommended to use right after delivery. You can actually use maybe after getting a green light from your doctor, maybe once your wound is much better, there's no any infection, everything is okay, you can actually use a lumbar support belt maybe towards the second week of delivery. As for normal delivery, you can actually use a lumbar support belt, providing, like I mentioned earlier, please get seek medical help from your doctor before you use anything.
I see. Okay. If there's no further question, I think we will wrap up this Q&A session. Thank you, Ms. Kumisha. That is truly entertaining and informative. And yes, we will invite you once again to join in our last talk of the series on Friday, 17 September at lunchtime, 1 to 2 p.m. to tune into our talk on safety in pregnancy by Dr. George Chan, our consultant obstetrician and gynecologist. Please follow and like our Instagram and Facebook for more information. Thank you, keep safe and stay healthy. Have a good day. Bye.